So now you've had your placement planning meeting. You're ready. Now in ST1, you have a lot of things to do, right? You have your clinical case reviews. You have clinical case reviews. You have your assessments, which we call case-based discussions, and SEPs. These are things we will discuss as we move on. Now, when it comes to clinical case reviews, you need to do 36 clinical case review in every ST year. So if you see the requirements, let's go to clinical case reviews. Okay, yes, clinical case reviews are also called learning logs. So if you look at the learning logs, just as I said, you have 36 in your ST1. That is about, I think that's the sixth line. 36 in your ST1, which is your first year, 36 in your ST2, 36 in your ST3. Since we're on this table, let's look at what we need. So for your mini KEX, which is more like your assessments, we'll talk about that. You need four. You need 4 case-based discussions. All these things, I would explain them in detail, so don't worry. You need your clinical supervisor review. You need your learning log. So this is a table. If you go back, so that you can know where I found it, and I'm sure it will also be in your demo when you get your course. So you can see what I clicked on. I clicked on training map. I now clicked on workplace-based assessment mandatory evidence summary sheet. Okay. So I clicked on that and it took us to that page. So let's not go into that because I'm quite sure it's in your demo for you to look at.
Thank you.
Okay, so coming to clinical case reviews, you need 18, you need 36 per year. That's 18 in every 6 months. Now, clinical case reviews is just cases that you see day to day during your rotation that has added to your knowledge and has helped you learn something. Case reviews. You want to write a new clinical case review, right? Good. So you click on it, and then this is what comes out. So everything depends on where you're seeing the clinical case review. So you have a title. You will generate your title yourself. For example, it can be managing a child that came with sore throat. So let's take managing a child that came with sore throat, for example. And I saw the patient in the GP surgery. So your title will be managing a child that came with sore throat. And then you put the date, and then you now say where you saw the patient. If you're in hospital rotation, almost everything will be hospital. If you're in a GP surgery, you click on GP. For some people, maybe people who have been in the GP surgery for a longer time, it might be a telephone triage. It might be a home visit. But because I'm talking about managing a child that has a sore throat, I would say this patient was seen in a GP surgery. Okay. So you click on GP surgery. Then you click on a brief description. Remember, it's supposed to be brief. And that is why I would always say there's an art to writing clinical case reviews. Nobody's asking you the patient came and for you to write a whole 10 pages. It's just briefly. This patient came with sore throat. It had been going on. What were your examination findings? What did you do for this patient? How did you manage the case? But remember, because you're a GP, you're writing it, taking into consideration the medical, the psychosocial, and every other thing that went on in that discussion. Because everybody will see a patient with sore throat. Everybody will see a child with sore throat, but you're trying to pick out something specific that you gained from that discussion. For example, I had seen a child with sore throat. The child was 7 years old, and at this point, the mom was wanting the tonsils out. Okay, so they had come, and she felt this was a bacterial tonsillitis and wanted the tonsils out. So I had to go into a discussion on the criteria for tonsillitis, whether they had been coming. Remember the 7-in-1, 5-in-2, I'm sure we would have that information. So because of that need, I had to do some form of education for that patient to tell her this has not reached this threshold. You need to come present to the GP every time they have a sore throat to be sure whether this means the central criteria, and then to know whether this child qualifies for tonsillitis. So it's not every case that you would write as a clinical case review. That's the point I'm trying to make. You have to say what you learned. And it's usually a brief description. So once you put that down, and these things is practice makes perfect. So your first entry may not be perfect, but the more you keep writing, you see that you get briefer. You pick out things that should be learned there. So when you write that, you now go to your clinical experience groups. Now I said this is a child. So obviously I would pick infants and children, young people under the age of 19. Now you can look at other things there. Gender and reproductive health, it may not fall in there. Long-term conditions may not fall in there. Older adult may not fall in there. Mental health may not fall in here. But what if you had to educate this person about tonsillitis, when it is viral, when it is bacterial, and did some form of education? You can also pick population health and health promotion. What if you said, what about gargling the mouth and things like that? So am I making sense? So you can pick infants and you can pick something else that also fits into your discussion with that patient. So when you do your clinical experience groups, then now you now go to your capabilities. You click on capabilities, and that's why I said you need to be clear on the cases. For example, if it's a case of you didn't know difference between viral and bacterial tonsillitis, for example, and you had to go and read on it, is it impacting on your fitness to practice? You know, if it's a case of maybe the mom could not speak English and you had to use an interpreter, can it go into communication and consulting? If it's a case of getting more information to know how many episodes of sore throat this child had, can it go into data gathering? So the point is, when you are writing a clinical case review, you need to think of what capability am I representing in this case. Now, one thing I must mention here is you can pick some capabilities, and some supervisors who are very detailed, when they are reviewing your entry, would remove some capabilities and say, this doesn't fit in with this case. So it all depends on what you did in the case that will make you choose a particular capability. So after that, you now go to your reflection. What did you learn? Some cases, you might just reflect on how difficult it was communicating with the parent. Some cases, it might be a child that has got sore throat but has some form of neurodivergence. How were you able to examine? So these are the things that can inform your reflection. Then what are your learning needs? Anything that you've learned. It might be that you didn't know the modified sensor criteria. It might be that you didn't know the fever pain score and it's a learning need. You can put it there. And then after that, you save. When you save, it goes to a table. If I save it here, I can't go to that table because I didn't put in any entry. But when you save, it goes to a table. It goes to another place where you can now send and select your supervisor. Your supervisor sees it and reviews. So that settles clinical case review. Now you can see more of this in the demo in your course to understand, to see the template on how this is written and take things from there. So back to the portfolio.